Ladies and gentlemen, and thank you for joining us back. I hope you all had a great lunch. Our next session is powered by Skinnovation. Well, I think we're wrapping up lunch for everybody now. Yes, so the next session is powered by Skinnovation. The session will focus on HIFU, best practices in anti-aging treatment. And the session is going to be presented by Dr. Gitanjali Nandini. Before Dr. Gitanjali joins us over here, a few words about her. Dr. Gitanjali Nandini is a medical director and consultant cosmetic dermatologist at Skin Nirvana Cosmetic Clinic, Mumbai. She is a trainer for advanced botulinum toxin fillers and threads. She is also a member of IMCAS, American Academy of Aesthetic Medicine. Her areas of interest and specialization include non-invasive and minimally invasive aesthetic procedures, correction of facial asymmetry and enhancing features with injectables, dermal fillers, botulinum toxins and threads, customized anti-aging solution with holistic approach, state-of-the-art and advanced lasers FDA approved, and clinical conditions such as skin infections, scar management and alopecia. Over to you, doctor, to take this session forward. We'll have roughly 35 to 40 minutes for the session. So Dr. Gitanjali will start with the presentation and then we shift to the live demo.
Good afternoon. I'm Dr. Gitanjali Nandini. Today we will be discussing about HIFU and its best practices as an anti-aging treatment. Okay, so anti-aging market is a fast-growing market worldwide. And what are the needs? What are the patients looking at when they're looking at anti-aging? So the demands are usually it has to be a non-invasive treatment if it's possible, a quick treatment which gives quick results, no downtime, minimal or no pain, and if it can be combined with other treatments, it has to be value for money and it has to be a reliable treatment method. So in the anti-aging basket, we have different modalities of treatment. That is the radiofrequency of conventional, radiofrequency needling. You have some lasers, but the current trend is towards HIFU now, because HIFU has been customized. You can say it's been customized to the needs of the patient. It has no downtime, absolutely no downtime, minimal discomfort, quick results, relatively quick in performing, and the results are pretty evident even in the first session, and the results last for a longer period of time. So what is ultrasound? Ultrasound is the wave with a frequency higher than 18 kilohertz. It is widely used in the medical field. It's used firstly for the diagnostic purposes. Secondly, it can be used for therapeutic purposes like tissue ablation in cancers, lithotripsy in renal kidney stones, and hemostasis. Okay. Now, how is HIFU superior to radiofrequency? HIFU has a lifting capacity, and the answer lies here. HIFU is able to produce energy at a depth of 4.5 mm, where the SMAS is, and the thermal coagulation causes the lifting effect. So in contrast to radiofrequency, which only gives you skin tightening, HIFU can also give you the lifting with the skin tightening. So HIFU is a non-invasive treatment with thermal effect produced in the skin tissue by ultrasound waves generated by the device. Like I said, it's widely used in medical and diagnostic purposes. Now, the features of HIFU in anti-aging: it's a safe treatment in all skin types. It's a non-surgical method, so no infection, no bleeding, no damage to other areas except for the targeted area, and a very safe modality of treatment. And the energies are quite high, quite powerful in producing collagen remodeling. Now, the principle behind HIFU, So basically, HIFU is energy waves, sound waves generated, which is focused to produce heat on a targeted, specific targeted area. So the sound waves which are produced are precisely delivered to a targeted area, the vibration of which, the molecules of which produce heat by the friction between the molecules, and that causes the tissue temperature to increase to 60 to 70 degrees Celsius, causing collagen denaturation and tissue destruction. And the two effects that are seen are, one is HIFU-induced coagulative necrosis, which is a temperature of 60 degrees Celsius maintained for a second or more. And the second is cavitation, which is acoustic pressure leading to expansion and contraction of the nuclei, causing cellular and subcellular structural collapse. Now, coagulative necrosis leads to skin tightening, and cavitation leads to fractional lipolysis. And when these sound energy is focused to a specific point, it causes thermal coagulative points. They are known as thermal coagulative points, also known as thermal injury points or zones. So HIFU has been clinically proven to be very safe, well tolerated, very precise in targeting, very consistent thermal injury, spares the epidermis, targets dermis, subcu and smooth tissues. No anesthesia is required, no adverse events, and no downtime. Hence the safety and efficacy of the treatment. Now to the cartridges which are used, the depths which are used for the face treatment. There are 4 depths here. That is 1.5 mm, which is mainly used for eyebrow, brow lifting, and forehead wrinkles. 2 mm, which is mainly used for the periorbital and perioral wrinkles. 3 mm, which is used for skin tightening on the face and neck and open pore reduction. And 4.5 mm is usually used for submental fat depositions. So submental fat deposition, jawline fat deposition, even if it's required in the cheek area, and nasolabial fold reduction. Okay. Now for the body, you also have 4 depths that we use. 6 mm, 9 mm. 6 mm is used for the bra fat, axillary fat, your arms, and décolleté. And 9 mm is usually used for your flank, love handles, saddlebags, and sometimes for the thighs. 11 and 13 mm depends on the pinchable fat, which can be used on the abdomen, buttocks, and thighs. So HIFU features again, very powerful energy leading to coagulative necrosis, no damage to other tissues other than the intended depth, a very safe technology, non-surgical, non-invasive, no bleeding, no infection. Safe treatment without side effects, and it's safe for all skin types. That was HIFU in general. Now, this is Ultracell Q+, which is a Korean company. It's from a Korean company called JSys Medical Systems. And what are the advantages of Ultracell Q+? It's the fastest HIFU. So the delivery of the treatment is quite fast. Full face can be done in half an hour. Body parts a little more than half an hour. And if you can see the number of shots that are shown, full face requires, that means up to the submental region, requires approximately 150 shots per side. So it's 300 shots altogether. And the different areas on the body require different, they require more shots. For the axillary area, be 100 shots per side, 300 shots for the décolleté, 200 shots for the arms, 300 shots for the flanks, and 500 shots for your thighs, 1,000 shots for the whole abdomen. But this is the standard given by the company. It all comes down to the patient needs, indications, and the outcome you're looking at. The other advantage is it's a smaller cartridge, slimmer cartridge, so better visibility, better placement, more accurate delivery of energy. So no blind spot. Okay. How do I switch on video? How do I put on the video? This is a video. That's a video. Stop playing. If I skip it, it's fine, no? It's okay, then I'll skip it. Chalega, then we go to the next. Next week, it's a
Do you have the video file as a separate file?
Someone else has done it, so I don't really know.
If you can
It's okay.
check
It's
and
okay.
come back.
Yeah, it's okay. So there are two types of cartridges used by this system, by this platform. One is called the dot cartridge and the other is the linear. The difference is the dot has got a fractionated delivery of energy, whereas the linear is a continuous delivery of energy. The dot cartridges produce local heating, causing collagen denaturation and hence new collagenesis and new elastolysis. This has got powerful lifting and tightening effect. The linear cartridge causes bulk heating, fat melting, and hence volume reduction. Very good for contouring and lipolysis. Excuse me. This is also video. This is playing. Yeah. Right.
This is okay.
Yeah, one is working. Yeah. So you can see the difference between the cartridges. This is the dot and that's the linear. Okay, the linear is much quicker to be performed, faster to be performed. You can see on the dot, you can see areas of normal skin. So that's what happens. When energy is emitted, it's delivered in a fractionated manner. Okay, now we'll discuss some clinical cases. Okay. So this patient, she came to me, she had gained a lot of weight during the pandemic lockdown. And basically she gained a lot of weight on her face. And what she came to me was for deflation of her face, reduction of volume on the face. So we, along with a little bit of exercise and a good diet, I did one session of HIFU full face. And it was not the energy that was stipulated by the company. I had given her much more energy. And you can see significant reduction. Yeah, significant reduction of volume in just 1 month. And the fat on her submentum, on the jawline, significant reduction of that. You can see tightening of her tissues. The ptosis is much less in just 1 month. Okay. This is what we commonly get in our practice, double chin. Okay. So I have tried various modalities for double chin, but I've been so far very satisfied with the result that I'm getting with HIFU. So this patient, as you can see, she's, yeah. As you can see, there was no definition of the jaw, none whatsoever, okay? And she's a very lean individual. So we have done 3 sessions, 3 months apart, 3 sessions of HIFU. And at the end of it, you can see that she has a good defined jawline. This is without any combination therapy. It's only with HIFU and a significant reduction of the submental and jawline fat. Okay. Okay. This is another common, what you see in your practice, commonly seen. Males wanting a more defined masculine look. So for this particular male, okay, right. So if you can see, very heavy malars, no definition of jawline, and chin was a little stub. So here in this patient, I've done a little combination. I did the HIFU first, and then followed it up with a little bit of chin filler, and he was quite happy with the result. This is only after one session. And you can see a significant improvement even on the frontal view. If you can see his cheeks and the folds, nasolabial folds. Same thing. This person wanted to, he's a bodybuilder, so he gained a lot of weight, but he wanted a very masculine look. It was quite a tough thing to treat, but he wanted a very defined jawline was what he wanted. And so we did 2 sessions of HIFU, 6 months apart actually for him, and a little bit of chin filler. That's all I've done. I've not done the jawline. That was just by HIFU, completely by HIFU. Okay, so this patient, she had COVID, and COVID ravaged her face. So she had severe volume loss post-COVID, and you can see that she had these 2 pouches on her face. So she came mainly for the reduction of the jowl fat. And just in one session, there has been a significant reduction of the fat, jowl fat. Another patient, these are the common patients that we see, heavy face, coming in for lifting, tightening, reduction of volume. She was a little tough to treat. This is after 2 sessions, but there was a significant improvement in her, the contouring, the lifting. She did not have, if you can see, you can't make out her neck, but here there is neck show. And her jawline was much more defined, cheeks much more contoured and lifted. Her nasolabials and marionettes improved. Okay, so another very common case that we see in the clinic is that marionette lines. And the patient didn't want to do Botox, didn't want to do fillers. So we addressed it with, I did HIFU, only HIFU, and she's gained a little weight in the second pick. But there was a significant difference in the folds. Okay, so this patient came to me for cellulite reduction. Very lean individual, but lots of cellulite on the back of the thigh and buttocks. This is after one session only with a 6 mm cartridge. Okay. We'll move on to the demo. Move on to the demo. Is this working? Where is this? Where? You're lying down. Can I have gloves? Gloves, yeah? Gloves. You can lie down. Machine is inside that way. You want to cleanse it? You need to clean him? No, no, then not. Are we taking his video? Is not going to be played. Because I'm going to show the marking. I need tissues and gel. Okay. They can't see, no? Yeah. Okay. I don't know whether this is working. Is this working? Hello. Hello. Okay. Yeah. Can the audience hear me? They can't hear me.
Can I see it or?
I don't know. They can't see the marking. Can they see the marking? अच्छा, ठीक है. I'll start. Okay. Yeah, I need a cartridge for marking. Okay. So first we'll start with the marking. Okay. Patient selection is very important. You cannot get a very lean patient, deflated patient, because even a 3 mm can result in volume loss in such patients. So you need to get a patient with good amount of volume, not too much volume, who can appreciate the results of HIFU. First, we'll have to mark out the no-go zones, okay, from the angle of the corners of the mouth actually, 1 centimeter from there. One centimeter from the lateral tragus, from the tragus. Can you smile? Okay, relax. Okay. Open your eyes. Yeah. Okay. So the good fat, which is on the malar area, is usually not targeted with 4.5 mm. You can do a 3 mm and a 1.5 mm on this area. And below this would be only, you can use all the 3 on the level below this. Jawline on the mandible, it is advisable not to do a direct shot on that, because it becomes a little uncomfortable. You can just lift up the tissues and deliver the shots. Okay. So the no-go zones would be corners of the mouth, 1 centimeter from the corner, the thyroid zone, okay, the area of the temporal artery. So these are the no-go zones, and the central portion of your brow. So to make it more organized, we create columns. So if you're delivering 90 shots on the cheek area above the mandible, you can make it more organized, 10 shots per column, and you can do a second pass, you can do a third pass in the similar direction, or you can go in 3 different directions. That's up to you. we start? Can I have some gel? Do you have a spatula? No, you need a spatula, no? .5 we are starting with, right?
Sure. It's connected.
It's connected.
It's 4.5.
Give it first. Start. So are we ready?
Which is
0.8. Yeah, that's fine. Okay, so we are starting with the shots. Give it a little lift as you're delivering. It's not moving. And try something else. Try this. Okay. You try another cartridge. Something's wrong with it. Is it filled?
it's free.
Filled. You can give around 10 to 15 shots per pass. And you can repeat the process till you've covered the whole area. Okay. Any questions from the audience? Can we open up the floor for questions?
Sorry?
You can open up the floor for questions.
Yeah.
Yeah. Okay. So it's machine is giving problems. Can be used? No. What is it? You're finishing? Yeah, you'll finish it off, no? Take it. Okay, any questions from the audience?
How long would the results last? How many
Sorry?
sessions and how long would the results last?
Okay, so once you do it, you should see it for up to 6 to 9 months in a young individual. I usually repeat my sessions after 3 months, and I see it for a good 1 year after that. Anyone else? Yeah. Yes.
What is the direction? How you use?
Yeah, you can do it in one direction, or you can do it in 3 different directions as well. There is no hard and fast route for that.
Okay.
The results start at around 1 month. That's when your collagenesis starts. Okay, so the results you'll keep seeing in the end of 2nd month and the 3rd month. So you repeat it at 3rd month when you get the peak of the result. So again, this is not a hard and fast rule. You can keep it at 6 months as well. But I prefer keeping it a little earlier because the results, I feel, tend to last longer. Yeah, you can combine it with radiofrequency tightening. You'll get even more, your skin tightening would be even better. Give it a gap of, I give 2 weeks gap between, no, first HIFU and then the Botox. First the heat, energy-based device, then the injectables. Anything else? Anyone else? Okay, thank you.
Thank you, Dr. Gitanjali, for that lovely session. And if you could just come on stage, would like to give you a token of gratitude.
That's it.